Nurse managers and other frontline leaders in hospitals are under tremendous pressure. They need help to streamline their work and identify opportunities for engagement with their teams and with their patients. How can technology help? As kids, we're always learning and growing, but as adults, we can sometimes lose that sense of curiosity that makes life exciting. It's easy to fall into a routine. Therapy can help you break out of it. If you've been considering starting therapy, now is the perfect time to give it a try. BetterHelp offers entirely online therapy that's designed to be convenient, flexible, and tailored to fit your schedule. Whether you're dealing with stress, anxiety, or seeking personal growth, BetterHelp connects you with licensed therapists who can support you on your journey to rediscovering your curiosity and becoming your best self. Don't miss out on therapy. Visit betterhelp.com/caretalk to get 10% off your first month and take the first step toward enhancing your mental well-being. That's BetterHelp, HELP.com/caretalk. Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Russ Richmond, co-founder and CEO of Laudio. The company helps hospitals improve their margins by streamlining the work of frontline leaders. Welcome, Russ.
Thank you. Great to be here, David.
Who are these frontline leaders and how are they doing these days?
Well, the prototypical frontline leader in a health system is a nurse manager. But that's only about 60% of them. The other 40% are a long tail of everything else, from lab, radiology, pharmacy managers to EVS and cafeteria managers. They're typically a frontline employee that has been done great at their work and been promoted into a management role without a lot of extra training or education. They have large spans of control, so they can have 50 to 100 direct reports, and we've seen as many as 250. Which is insane. They are the busiest people you've ever met, because between managing everyone on their units and keeping up with all of the compliance and protocols, keeping the floors staffed and onboarded and auditing the work, there's just too much to do. And they're across a 24/7 operation, and they only work, 12, 10 or 12 hours a day. So it's a big job, an important job, and a crucial job, but a busy one.
What do these frontline leaders need to thrive, and how does Laudio fit into this?
Well, what every frontline leader will tell you is they enjoy the one-on-one connections with their teams. The problem is that all the administrative work that gets between them and them doing their frontline manager jobs. So what they really need is they need automation. Some of this administrative work is very manual, time consuming. As an example, many frontline leaders have told us, like for a performance review, they'll have to go through their file cabinet to look for pages they printed out from Outlook about their various employees, and then they aggregate those and do the review. So just hearing that, there's so many ways to make that easier, better, faster for them. So they need that work automated away. And the second thing I'll mention is they need to be recognized. These are the folks, the glue in the system, making the system hang together. And not only do they need automation, but they need to be recognized for what they're doing and supported. And that's what we hear from them day in and day out.
Automation and laudamation.
Yeah, exactly. Well said.
So these frontline managers, very important. They're the users, but they're probably not the buyers. So how do you persuade the C-level leaders in a hospital that Laudio is a good investment?
Yeah, we start with the fact that our platform can help them care for more patients at lower costs with better outcomes than has ever been possible before. And the unlock, the area that they have underinvested in, that we support, is the frontline leader. We believe that by turbocharging that frontline leader, we can make their job better and more satisfying, and also really increase the output of value-added work. What health system leaders really clue in on right now are two things. One is an ROI story around getting cost out of the system. Everyone knows that that is an imperative for health systems everywhere. There's limited places they can go to get the cost out. And we found one. So just doing that, reducing turnover, improving retention, reducing overtime costs, improving the patient experience. There's all kinds of mechanisms to get at that. And the second is that health system leaders everywhere know their managers are underwater. They would not be surprised to hear anything I just said,
Yeah.
but they don't know what to do about it. So knowing that they can use Laudio to support their leaders, improve that job satisfaction, and invest in these key personnel is often a big selling point for us.
Well, that's it for the latest HealthBiz Brief. If you like what you hear, check out my HealthBiz podcast for a full-length interview with Russ about his life and career. Russ Richmond, CEO and co-founder of Laudio, thanks for joining me on HealthBiz Briefs.
Thank you, David.